Every year, there are various issues regarding internships for those in the medical field. This year is no different. This week, a group of medical interns expressed their grievances after the Ministry of Health failed to deploy them. Now, the pre-medical interns are seeking an audience with the Ministry of Health. They claim that the ministry has not responded to their queries regarding internship deployment, as some missed out on the deployment list released on Monday.
It is the security men on the gates. Or if you are very lucky and you enter, you may get a secretary to tell you, what a note, your issue is being handled. So, honestly speaking, we've not had access to the Director General in person, to the Permanent Secretary in person, to the Commissioner of Clinical Services in person, or to the Minister of Health herself.
If we're having an influx of numbers, control the numbers. Start from entering to universities, or maybe entering into the health sciences, or into the biological sciences at high school. Then control the numbers as you go up. Otherwise, if you let people into a room and then suddenly say there's not enough air for everyone to breathe, so you're going to let some people breathe. Why do you let all of them into the room in the first place?
You find private universities every semester. First of all, they have a lot of intakes. Per intake, they may have like 400 students. Then the other intake, they have 400 students. Those are 800 students. Yeah. So when they keep releasing every semester students, you find that the number is so overwhelming.
The Ministry of Health has a budget of about 35 billion shillings. According to ministry officials, they focused on deploying the backlog of medical interns and senior health officers this year. However, the pre-medical interns dispute this.
Those who were not qualifying to get the certificates or to register for internship cannot be called the backlog. Duachi, bali bachina duties, either it takes or they were still in the course of the semester. So therefore my point is about backlog. Backlog is not a year. Because if someone finishes in 2023, then the following year, maybe February, just a few months apart. So the only backlog by the factor of the year of completion, no ita omlala. It's yet backlog wa 2024.
What is the problem? Is it the issue of funding? Is it the issue of facilities? Is it, it's an issue we need to tackle, we need to come up and we work together as a government and we ensure it is sorted. Because if you're telling these interns that you're giving them another year at home, without anything. I've done my part, I've finished the studying, but you are saying I cannot practice until I do internship. But then you're not taking me for internship.
Whether the concerns of the pre-medical interns will be addressed remains to be seen. In related news, the Association of Graduate Nurses and Midwives wrote to the Ministries of Health and Education this week, urging them to reconsider the proposal to abolish internships for nurses who are upgrading but have a history of working.
The key disciplines of nursing, which is medical, surgical, ped, and women and reproductive health, are given little time. So you realize they provide more of theory and less of practical, which supposing the practical part should be strengthened during the internship program.
Nobert Atukunda, NTV News.